picture of Jennifer George after having a CT head exam performed by the defendant, Heather Workman. During this procedure, Jennifer had told Heather that her head felt strange and that her head felt itchy, but the defendant, Heather, did not stop the exam. Instead of stopping the procedure, like Heather should have, she continued, even though there were verbal complaints by Miss Jennifer George telling her about the problems going on with her head. The ARRT Code of Ethics number 7 says, and I quote, "The radiologic technologist uses equipment and accessorizes employees, techniques, and procedures, performs services in accordance with an accepted standard of practice, and demonstrates expertise in minimizing radiation exposure to the patient, self, and other members of the healthcare team." According to this code, Ms. Workman did not have the right standard for the CT machines, or my client, Jennifer George, would not have received the radiation burns or the hair loss that she did. It is your duty today, ladies and gentlemen of the jury, to decide whether the defendant, Heather Workman, is personally responsible for the injuries that were received by Jennifer George.
Ladies and gentlemen of the jury, the prosecutor is going to try to paint a picture that it is the sole fault of Heather, the lonely technologist, that it is completely her fault. However, that is not the case here. What the prosecutor has failed to mention is that there were problems with the CT machine, people that are checking it, possibly even the manufacturers. No, they're going after Heather because she has money. Her grandmother left her money, and now the prosecutor is trying to take it. What I want you to remember, guys, is that Heather here, she didn't think anything was going wrong. It was a normal variance, things that happen in her daily job, just like we all do. I am not trying to excuse her behavior, but what I want you to do is keep an open mind throughout this trial. I want you to think about what you all do in your daily jobs, and then make your decision.
Is it true that you felt your skin itching during the exam?
Yes, ma'am.
Okay. And did you tell Ms. Workman the condition you were in while you were in the CT machine?
Yes, I did.
So, in your perspective, what exactly happened during the exam?
Well, it started like this.
Come in this room right here.
What's this?
This is the CT scanner.
Do I want to go in that hole?
Yeah, just your head.
Are you sure about this?
Yeah, do it every day. Alright, just gonna get up here, and we're gonna raise you up and push you back in there just a little, okay? Be careful. That way.
No. You should have told me.
Sorry. Okay. Now your head has to fit in this, so raise up just a little bit more.
I don't think my head's going to fit in that thing.
It will, I promise.
I got a little bit of a fat head.
Oh, your head's fine. Now I'm gonna put this under your knees. It's enough. Okay. Yeah, is that better?
Yeah.
Okay, I'm gonna raise you up and push you in now. Okay?
I'll be okay.
Okay, now I'm gonna go back in this room, but I can hear you if you say anything, okay? If you need anything, let me know.
Okay.
Okay, everyone, start the scan now. Don't move.
Okay, sorry. It's really starting to hurt. It's burning. It's itching.
It'll be okay. Just don't move and we'll have to do it again, okay?
And since hearing your story, do you believe that Ms. Heather Workman should be personally held accountable for the injuries that occurred to you?
Yes, I do.
So, Heather, do you think the patient's allocation of what happened was correct?
No, it didn't really happen like that.
No, not at all. Okay. So, well, tell me in your words what happened.
Well, it kind of happened like this.
Okay, we're going to start your scan now.
Heather, I think she's moving.
Don't move.
Really? Did I not say anything?
Don't move. We're going to have to do this again, so just hold real still, okay?
I think you always get the patients that move.
Really? You don't know later. We'll have to do it all over again. Why not just fix it a little bit? It's not that bad.
So when the patient was moving, what did you think was going on?
Well, patients move all the time. I thought she was just uncomfortable. CT machines are really uncomfortable when every patient moves, and then you just have to take it again and give them more dose. Do
Right.
the whole thing over.
Okay. So patients move often during your
Yes,
exams?
all the time.
Okay.
They're always complaining. They're always
Mm-hmm.
moving. It's really uncomfortable. I'm not
Okay.
gonna lie, but
Okay.
they all do.
Okay. So in your daily duties, did you do your calibrations in the morning for the CT machine?
Yeah, I did that, and
And-
everything went good.
Everything went good. You didn't see any problems with the CT
No.
machine at all. Nothing showed up that would have said, alarm, something's going on.
No, nothing at all.
Okay. Did you mean to do any harm to Jennifer George?
No, I never would ever mean to do that on purpose.
Okay. And what about, the prosecutor's going to ask about the dosage levels that you see on the screen.
Yes.
What do you all think, do you use the dosage levels?
Well, usually none of us do,
Mhm.
because they're usually not right. They're usually not accurate.
So you guys normally, they're on there, but you don't really go by them.
Right.
Okay. All right. Thank you, Heather.
Ladies and gentlemen of the jury, since the evidence has been presented, we believe that Heather Workman should be held personally accountable for the injuries done to Jennifer George. The ARRT Code of Ethics number 5 states, and I quote, "The radiologic technologist assesses situation, exercises care, discernment, and judgment, assumes responsibility for professional decisions, and acts in the best interest of the patient." If Ms. Heather Workman were really acting in the best intentions of my client, Jennifer George, then she would not have received the radiation dose that she did. And it was Ms. Workman's personal professional decision that led her to believe that Ms. Jennifer George was perfectly fine when she had complained that she wasn't. It is your choice, ladies and gentlemen of the jury, to hold Heather personally accountable for the acts that she has committed against Jennifer George. Because unless the CT machine was running correctly from Ms. Heather Workman, then Jennifer would not receive the burns and the hair loss that she did. Thank you for your time.
Okay, ladies and gentlemen of the jury, the prosecutor presented a decent case. But the question is, was my client Heather at fault? Was Heather at fault? No. The answer is no. My client was not at fault. What happened here was is the prosecutor going after the hospital? Is the prosecutor going after the manufacturer? No. They're going after my client. Why? Money. Couldn't get it from the hospital apparently, so they're going after Heather's money. Money her grandmother left her. This case has presented a good question though. The question is, who is at fault? Hospital? Manufacturer? The problem was with the machine. The problem was not with the RT. The RT was simply doing her job. No one is stating that the patient, did not get injured. However, is the RT to blame? No. It was the machines. There's a breakdown. There's a breakdown in the system. There has to be things that are implemented so that we know that there's harm coming to the patient, that they're being radiated more than they should. This is the question you have to ask yourselves. It's a very, who is at fault? But what I'm saying is that it's not my client. Heather is not to blame. She should not to be the one that should have to pay. Please consider these considerations when you go back to deliberate. Thank you for your time. There were many aspects to consider in this case. Was the radiologic technologist negligent in her behavior? And if she was negligent, is she liable? Should she have to pay punitive damages to the patient? My ruling as the judge is that even though Heather Workman did not intend any harm to the patient, she is still liable. Therefore, my decision as the judge is to state that Heather Workman must pay punitive damages in the amount of $10,000 to the patient, Jennifer George. We're gonna appeal!
The point of our video was to point out the term of negligence, in which in this case was harm being done to the patient, but not intentionally.
The most important thing to remember is the patient and patient care.
Even though it's important to get our exams completed, we should always put the patient first.
Okay, and then I'll tell you what negligence is.
Be careful. Be careful.
Negligence is when something, I completely forgot what I was saying.
Finish our exams and get them all completed. We should never do anything to the patient.
She's like, cut!